Hello, my name is Marina Sullivan. I'm with Boston University School of Social Work, and today I will be talking to you about our preliminary findings from the HIV Housing and Employment Project, an initiative that coordinated HIV care, housing, and employment services for people living with HIV to improve HIV health outcomes. So the main finding from our preliminary analyses is that coordinated HIV care, housing, and employment services can improve housing and employment stability as well as HIV health outcomes for people with HIV. So I want to give you a bit of a background on the HIV Housing and Employment Project. So this project is funded by the Health Resources and Services Administration as a special project of national significance. This initiative provided people with HIV in low-income and racial and ethnic minority communities with coordinated HIV primary care and housing and employment services to improve engagement and retention in HIV care and supportive services. We know that people with HIV with greater housing stability are more likely to be retained in their HIV care and to be virally suppressed compared to those who are unstably housed. We also know that employment is associated with movement along the HIV care continuum in terms of HIV testing, linkage to care, and adherence to HIV medication. Normally, we see HIV care and supportive services, such as housing and employment services, separate from one another. Given the importance of housing and employment stability in achieving HIV health outcomes, 12 demonstration sites developed and implemented innovative care coordination models to enhance access to care for people with HIV by forming multi-sector collaborations between HIV care, housing, and employment providers. For this project, Boston University School of Social Work served as the evaluation and technical assistance provider to the project's 12 demonstration sites. In terms of our methods for this project, the eligibility criteria required that a participant is a person with HIV over the age of 18 who is either newly diagnosed with HIV, has missed recent HIV care primary visits, is at risk for falling out of care, or is not virally suppressed, and is homeless or unstably housed, and is unemployed or underemployed. Underemployed could mean that a participant isn't working as many hours as they would like to, or isn't working in the sector that they have the skills to work in. In terms of data collection for this project, we collected data from the 12 agencies that participated between May 2018 and August 2020. Our data collection tools included client interviews, which were distributed at a baseline period and post 6 and 12-month periods. This included demographic data, as well as housing and employment data, and different co-occurring challenges that participants may have, such as mental health issues, food insecurity, and things of that nature. We also collected medical chart data at baseline, post 6 and 12 months, and for a subsample at 18 and 24 months as well. This information gave us the data about our primary HIV health outcome variables of interest. We also collected encounter form data about what interventionists at the agencies were doing with clients, what they were helping them with in terms of employment, housing, and coordinating other services for them. We collected data at the aggregate level. So for all clients who were receiving services through this project, including those who may not have enrolled in the study, but we collected aggregate information about their housing and employment and HIV health outcome status. And we also collected qualitative data at both the client and staff levels to collect information about perceptions of the intervention. And the data that I'm going to talk about today focuses on the aggregate data related to HIV health outcomes and employment and housing outcomes, as well as some of the chart data. And this is only at the baseline and 6-month periods, as we just closed data collection and we are still analyzing a lot of this data. We extended our data collection period due to the COVID-19 pandemic, given that a lot of agencies were having trouble collecting chart data from different health care organizations that were dealing with the pandemic. And then for our results from this study, we had over 1,200 clients enroll in the project. Over 1,000 of those clients enrolled in the study. And then before I get into the results, just some information about the demographics of the participants who did actually enroll in the study is that at baseline, the majority of participants were literally homeless or unstably housed. 87% of participants were, and the remaining 13% may have been at imminent risk for homelessness or stably housed but at risk for losing their housing, such as if they had a eviction notice. So the majority of our participants were literally homeless or unstably housed at the time of enrollment. The majority of clients, 78%, were cisgender males. 17% of our clients were cisgender women, and 5% of clients were transgender clients or of another identity. And then in terms of race, the majority of participants were from racial and ethnic minorities. 43% of participants were African American, and 33% were Hispanic Latinx. Getting into the results at the 6-month period, in terms of the HIV care continuum, at 6 months, 77% of participants had been linked to care, meaning that they had at least one HIV primary care visit within 90 days of enrolling in the HIV Housing and Employment Project. 47% of clients at the 6-month period were engaged in care, meaning that they had at least 2 appointments within those 6 months for their HIV care. And 76% of participants were virally suppressed by 6 months into the study. So there were a lot of positive health outcomes at that 6-month period for the clients enrolled. In terms of changes in housing status, we found that at the 6-month period, 23% of clients had stayed homeless. However, 25% of participants had obtained or stayed in some sort of temporary housing. 41% of participants obtained or stayed in permanent housing. And we also found that 11% of participants became more unstably housed. So that may have meant that these were some of the clients who were stably housed at baseline, but were at imminent risk for falling out of their housing. And at the 6-month period, they may have lost their housing and had not achieved housing at the 6-month period again. And this data shows that housing it's not necessarily a linear process, but it's great to see that so many participants had achieved some sort of temporary or permanent housing within 6 months of enrolling in the HIV Housing and Employment Project. In terms of employment status, as you can see at the bottom of this slide, At the 6-month period, we separated clients into 2 groups. So at baseline, there were clients who reported that they were not seeking employment, as well as clients who had reported that they were seeking employment. So for the clients who, 38% of clients who said that they weren't seeking employment at baseline, we found that 6 months in, they were still not seeking employment, 42% of them, that is. However, we did find that 23% of the clients who had not been seeking employment had become motivated to seek employment 6 months into this intervention. So the services that this intervention provided may have attributed to that motivation, but we did see a change in motivation for some of these clients in terms of wanting and seeking a job. For the 62% of clients who did say that they were seeking employment at baseline, we found a few different ways to categorize them at the 6-month period. So 19% of these clients had gained or stayed employed within 6 months of enrolling. So this could mean full-time employment or part-time employment. We found that 30% of these clients were motivated workers. And what we mean by that is that these clients, they were unemployed at baseline and they had wanted to work. And at 6 months, they had got maybe a temporary job or a part-time position, but they consider themselves still to be underemployed and that they either want to work more hours or find more meaningful employment. However, this 30% were working in some capacity within this 6-month period. And then we found that 51% of those clients that had been seeking employment at baseline were still what we call job seekers. And this is meaning that these clients didn't have employment at the 6-month period. However, they were still seeking employment and or were receiving employment services to help them obtain the job that they did want to have. So these preliminary results from the HIV Housing and Employment Project provide us with a glimpse of how coordinated HIV care, housing, and employment services can not only improve HIV health outcomes for people with HIV, but also may simultaneously improve housing and employment stability. Our team at Boston University School of Social Work is currently analyzing client interview data as well as HIV health outcome and employment and housing outcome data beyond the 6-month data that I have presented here, which we will be sharing in the future. So thank you for attending this presentation, and I look forward to sharing with you more results from this project in the future. So if you would like more information about the HIV Housing and Employment Project, you can feel free to contact me here. I am the program manager for this project at the School of Social Work. My email is listed here. The project itself also has a web page on the Target HIV website, which is listed here, and you can find more information about the project as well as some resources at the link provided. I'd like to thank my team at Boston University School of Social Work, Tom Byrne, Serena Rajabian, Jessica Flaherty, Julia Cantner-Doherty, for all their amazing work as we continue to analyze all of the data from this project. So please feel free to reach out, and thank you for joining this presentation. Thank you.